What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
Good morning, everybody. This is Dr. Zach Baker of Rehab to Perform and R2P Academy. And on today's podcast, we have with us one of our two sports residents, Dr. Abbey Hammann. And as we do every month, we have our sports residents dive through the literature, find an article on a topic that is relevant to what we're learning within the residency. And in the current month that we are in right now, they are looking over the spine. And we cover a little bit of everything, but predominantly lumbar and thoracic. We hit cervical spine when we go into some of our concussion-oriented modules. And we also lump C-spine in with our shoulder modules as well. But Abby, do you mind telling the listeners what was the article that you chose for this month?
So the article that I chose this month was titled Return to Sport After Adolescent Idiopathic Scoliosis After a Correction Surgery. This was a retrospective data analysis. It was all performed within one facility. There were two surgeons. All imaging was performed by one person. It was all read by one person, and then all data was collected by one individual as well. With this, they had a total of 113 participants, and they all received a posterior fusion. The length of the fusion was grouped by greater than 10 segments, less than 10 segments, and then kind of based off of where the fusion was taking place. So was it thoracolumbar? Was it more lumbar? Or was it more thoracic? For the most part, if it was lumbar, they excluded these participants from the study as part of the inclusion criteria. The ages for these individuals was 10 to 22. And they were essentially looking at, hey, a lot of kids these ages with adolescent idiopathic scoliosis are involved in sports, whether they go the conservative route or the surgical route for corrections. How does that impact their level of play after intervention? So this was kind of looking at the surgical intervention piece and how that would affect them pre to post operatively.
Cool. And I mean, my general understanding, there's not a lot of conclusive information or just a lot of data out there that indicates what the recommendations are with regards to the timing of return to sport, and then also just expectations of outcomes with that. So do you mind, with this study, what were like the three big objectives that they were trying to hit? What were or at least the three different ideas that they were trying to provide a little bit more clarity on?
So the authors of this study wanted to provide a bunch more clarity on the timeline of return to sport. So with the timeline, how long did it take after the posterior fusion? Based off of a couple different factors, did it take that individual to go back to sport? Did they have to modify their activity as the second objective? So when they went back to sport, was it at the same level, or did they go back to sport, but maybe they went from a contact sport like soccer and then had to go to a non-contact sport like maybe like tennis, swimming, something of that nature? And then the third objective was looking at the surgical intervention. Did the length of the posterior fusion perform? Did that affect how that individual was able to go back to sport? One, were they able to? And two, if they did, was it to that same sport, that same level of contact, same level of competition as well?
And these are important things to consider because it's a significant surgery that somebody's undergoing. And being armed with this information as the patient and the patient's family who's going to be making this decision, knowing how long you're going to be sidelined from activity is a really important thing to know, to figure out, especially if you're kind of a borderline case of, should I get the surgery, should I not get the surgery? Or if you're just trying to figure out what's the best time frame to do this, assuming that's not an urgent situation, you're not having remarkable functional limitations or uncontrollable pain that's contributing to it, and you're just trying to figure out logistically, do I do this in the summer? Do I do it in the winter? Do I do it during the season or out of the season? Knowing that timeline is really important to help out just from a planning standpoint. With regards to the activity modification, having a good idea of kind of what your ceiling for potential or expectations for ceiling for potential is also important to know after you have the surgery. And if this is a surgery that's going to force you out of whatever your sport is or whatever your desired leisure activities are, you need to really put some thought into, do I need to go down this route or do I want to go down this route? Or if you can have this surgery done and you know that the data and the literature shows most people make a full recovery and they return back to whatever it is that they love doing, that makes that decision a lot easier. Unfortunately, not all surgeries, whether it's this one or other ones that we talk about, allow you to return at your desired level function, or just the odds may not be in your favor. So having a good idea of what the surgery is, what it entails, how that may influence your current participation status and future participation and competitive level that you come back at is very important to know. And then the extent of the surgery can drastically differ from one person. And whether we're talking about a 2 or a 3 level fusion or a 8, 9, 10 level fusion, that's going to really impact the previous conversations that we just had on the other 2 items. So you talked a little bit about the patient population that was involved. Do you mind going through anything else in regards to just the eligibility criteria for these individuals or what was done as an intervention for them?
Yeah, so since this was a retrospective study, they were looking at patients that started their therapeutic interventions from 2010 to 2018. They were younger adolescents that had some sort of sports participation. The level of sport participation was not something that was included in the study very specifically. They did come up with statistics and things that were in regards to, hey, this individual was playing a non-contact sport or a contact sport and now are playing a contact sport versus non-contact sport. A big other thing in this study was they had to have availability of the individual's pre- and post-operative spine radiographs, and those were all read by one individual. These patients had to have completed their questionnaires completely, so they weren't accepting any patients into the study that had not filled out the designated questionnaires and other information that had to be filled out. And the data collection for the study, they had to have at least 2 years of information on these patients post-surgery. So they wanted a great deal of, hey, you were able to return back to sport. Did that follow through in the long run? Or did you go back, you played a little bit, and then you were unable to continue because of surgical intervention or other means?
Good. And I like that time frame because I think 2 years is realistic for people to get through the post-operative rehab process, get through a few calendar years where they actually have the opportunity to return to whatever sport that they want to from a time frame standpoint. And within 2 years, you should have a pretty good idea of if you're functionally able to get back and how well you've gotten back with that. So I do like that portion of it. Do you mind talking a little bit in regards to how they delineated the different groups or just some of the, as they went back and retrospectively looked at this, how did they classify groups or how did they put people into different groups or classifications?
Yeah, so they use the Lenke classifications for the scoliosis curve types. So that's types 1 through 6. They denoted how many individuals were in each group. Luckily, in this study, they had a few individuals in each group. The one with the highest percentage within total population was main thoracic or the type 1 in that classification. Additionally, they grouped all the patients in the study by fusion length grouping. So if they had less than 10 fused levels, they were in that group. If they had 10 levels, they were in the less than 10 as well. If they were greater than 10 fused levels, that was an additional group. And then they also had a subgrouping within the length of fusions for, was it thoracolumbar, was it lumbar, or was it thoracic?
And then what did they actually end up finding? When they went back and looked at this, what did they end up finding in regards to outcomes or just actionable data that we can work off of?
Yeah, so the big clinical outcome was they noted a big shift from chronic pain in participants in this study preoperatively to the occasional discomfort postoperatively. So 74 patients declared chronic low back pain preoperatively, and then afterwards it was only 10. So that went from 74 to 10, which I feel like is That's pretty huge. Big jump. Yeah.
I'll say that makes you feel comfortable that they made the right decision to get the surgery done.
Yeah. So for us, that's a great thing for us to look at clinicians is, hey, we know that this can help with some of the pain that you're having, but looking further into it with some of the other things that we'll discuss is going to be, hey, you have less back pain, but do you have the ability to continue performing at the same level or return to the sport that you were in? So big things stats-wise that they looked at is 78% of the population was involved some sort of like structured sports preoperatively. 76% of those that were playing sports were non-contact, 20% were contact, and then there was a small amount of like 3.4% that were a blend of contact and non-contact sports.
Good. So a large 80% of this group, roughly 80%, was physically active in structured sports preoperatively. What ended up happening postoperatively?
So postoperatively, 89% of participants in the study were able to participate in sports postoperatively. So that was a big thing as I was kind of reading through the article was, wow, this is awesome. More people after having surgical intervention were able to return to sport. So that number increased. And then only 4% of individuals, though, were able to return back to contact sports. The contact sports involved in this study was only football that I could see. So I feel like that was kind of a limitation, especially with other like field sports. So it was only looking at kind of football as the population for contact.
Yeah, and that makes sense. You have the nature of the surgery. People are able to stay active following, but it may lead them to pursuing other means of being physically active. And I think those are two big takeaways. There's a very similar group of people that were active preoperatively that continued to be active postoperatively, and the number actually increased, which tells me some people were unable to participate prior to surgery because of either the pain or the functional limitations they had, that getting the surgery actually allowed them to participate, or people who were participating prior to surgery were continuing to be able to afterwards. That is one thing to note, though. You had a reduction in people participating in contact sports, so some of them may be kind of shifting what they're involved in, which can be a good or a bad thing. You know, if you love playing football or rugby and you can't go back to that stinks. But it may provide people an opportunity to pursue different sports or activities that they never even entertained prior. So that happens at different points of our life, whether we hit a certain age or just competitive participation is no longer an option because you age out of what's available, or just physically, you're not in a position where you want to put your body through that type of sport, and you transition from maybe your field or court sports to your endurance sports or your other activities. So that is a interesting metric that I think you could probably come to a few different conclusions off of. What else did they find, either in regards to time frames for like how long it was taking for them to return to sport or anything along those lines?
So a big conclusion for this study was that it took about 8 months with an over-under of 7 additional months or 7 less months to return to sport preoperative to postoperative. Big things that I wanted to see was how that affected them, whether they were contact-related sports or non-contact. So individuals that were in contact sports were 11 months on average for return to pre-operative levels, and then non-contact was about 9.7 months. So that's like about a month and a half between the two. And there was a great deal of variability as far as did it take a little bit longer, did it take a little bit less time, but overall on average between holistically like contact and non-contact about 8 to 10 months.
And I think there's a variety of things that factor into that. I would like to think the type of surgery that was performed and the severity or the extent of the surgery that was performed in regards to, you know, was this somebody from one of our groups that had a specific type of surgery done, type 1, 2, 3, 4, 5, or 6? The fusion length grouping, the group that had less than 2 fused or 10 fused levels or more than 10 fused levels, I'd have to imagine they're going to be either on the longer or the shorter side of the recovery as well. And then the type of sport that you're going back to also. All of them have different demands, and some of those demands you can entertain earlier on in the recovery process. Others, either just due to biological healing timeframes, take longer to become medically appropriate to entertain, or it may just be a very vast, variable, complex skill set that you need to develop that it may take a month or 2 or 3 to just recover from the surgery, and then another 3, 4, 5, or 6 months to get back into the shape that you need to be in to play that sport. What were some of the either results or just kind of like bottom line takeaways that you took from this?
So some of the things, we've talked a lot about significant things that they found, but some things that they found that didn't have really any strong correlation was in regards to time until the individual could return to sport is the patient age at the time of surgery. Didn't really matter. The amount of back pain frequency-wise they were having didn't really have an effect. The individual sport category wasn't huge in regards to their return to sport timeline. The Cobb angle, which was surprising to me, whether that was... I
thought that would have been up there.
Yeah, so whether it was like higher or smaller, that didn't really have an effect on, at least in this study, in regards to their timeline. And then the fusion length, which was also very surprising to me, whether you had less than 10 segments or more. So
ignore what I just said about a minute ago.
Yeah, so that was interesting to me. Big thing with that, though, they pointed out in the article is that, hey, these things we didn't find significant in our study, but it definitely needs to be looked into further because these are things we were surprised about as well. But there were a lot of other limitations where they were like, we were only performed it here. We were very specific, which is not a bad thing, but we didn't have a lot of variability where we could kind of pull from multiple different instances, and it was just this one retrospective study we were looking at.
Cool. What are your big takeaways from this? Is there anything that you can kind of say was definitively found from this? Or is there just anything that you as a clinician feel more confidently talking on? If you were to have, say an adolescent or a high school or a collegiate athlete come to you, or even an adult athlete, different age range from this study, but if you had somebody coming in and they're entertaining this surgery or they've had this surgery, what do you now feel equipped to tell them?
Yeah, I think this was very helpful for me as a new grad to look at. I really wanted to look into an article that had to do with sport, return to sport after fusion, because I have seen a couple younger patients in clinic, and I wasn't too sure on the return to sport timeline. And as far as like patient expectations, I feel like I have a greater understanding as to, hey, this will take probably on average at least 8 months to get us to where you were at before for actual return to your sport. That might vary depending on the characteristics that individual has. And it can take an upwards of 12 months to return to structured sport, and then another like 12 months on top of that. So 24 months to return to like club or high levels of competition. Big things for me were just understanding the return to sport timeline for a surgical intervention, whether it's in individuals with scoliosis or if it's just a fusion within the age groups that they looked at here. And in addition, just taking into consideration that the post-operative return to sport is going to be a multifactorial decision. And this is all great information to have and can kind of help set expectations, but it's not going to be the end-all be-all as far as sticking straight to it. Hey, 8 months, you're good to go.
Awesome. So the classic, it depends, is what we get with it. So, Abby, appreciate the time and effort on this one. Thank you for this, and I look forward to hearing from you next month when we get into the elbow, wrist, and hand.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.